All right. Hi, and welcome to our not so live Facebook conversation. I'm Caitlin Engel. I'm the Program Development Director here at the National Kidney Foundation. And I am so happy to be joined by Dr. Holly Kramer, who is NKF's president and also a professor of nephrology and public health at Loyola University. We also have with us Curtis Warfield, who is a kidney transplant recipient and also one of the members of our Kidney Advocacy Committee. So Curtis and Dr. Kramer, thank you so much for being here and going with the flow today.
No, thanks for having us. We really appreciate it.
Yeah. Definitely.
So I'm really excited to just continue our conversation today about sharing important information for the kidney community around coronavirus, also known as COVID-19. Hopefully we can talk about some steps you can take to protect yourself as a kidney patient, manage your diet, and also manage the stress that goes along with living through this global pandemic. So with that, I think I'll just go ahead and get us started. Dr. Kramer, do you want to talk a little bit about any of the recommendations that we currently have for kidney patients to keep themselves protected?
Right, so the most important thing would be to do the social distancing, which most of us are doing. I think if you're in a state that is not enacting social distancing, you should do it yourself and really limit your interaction with other people. So I wouldn't go to a church service where there's other people. I would limit the time I go to the grocery store. I would not do unnecessary shopping outside, and I would not visit with family or friends, and just really try to do the social distancing. If you do go out, just like you would wash your hands at home before you eat, just make sure that you wash your hands when you get home from going to the grocery store or the pharmacy. And you really need to wash your hands for 20 seconds. So that's generally like singing happy birthday song is about 20 seconds. And also make sure that when you wash your hands, you get this part. People tend to wash their hands like this. You want to make sure that you also get your thumb region as well when you wash your hands. And so just make sure you do that. And then when you are out, really try to make sure that you're not touching something and then touching your face or your eyes, because the COVID-19 virus can actually stick to surfaces for many hours. So someone could be sick and then touch that item and put it back on the shelf. So, just as long as you're out, just, don't touch your face. And then when you get home, wash your hands really good. So I think the social distancing is probably the most important. Then the other issue that has really recently come up is whether or not you should wear a face mask when you're out. So the face mask is really more important for you transmitting the virus to other people, because as you know, there are people who can carry the virus and be completely asymptomatic, and they could be spreading it to other people. Mm-hmm. So you wearing a face mask is really more of protecting other people. You really need to have a specialized face mask to be out in the public to prevent yourself from getting it. And those are generally what's worn in hospitals. So so just having a face mask doesn't mean that you're 100% protected from getting it from other people. It's really more of you giving it to others. So I would recommend to wear a face mask. I wear a face mask when I go out, but I know that it's really me protecting others and not necessarily protecting myself. So I'd be interested, Curtis, like what are you doing to try to protect yourself from the COVID-19 virus?
Well, I am now staying at home a lot more. At the beginning of it, when things were still kind of on the other side of the ocean, but were being talked, it became a little bit of a concern. And then after it really hit here in the United States, that's when we took a little more precaution. And now my wife and my oldest son do most of the shopping for us and stuff. Like I said, I stay here at home. I do still get out, take a couple of walks and stuff. I get out to enjoy the outdoors, but being around other people, that has become basically a no-no for me. Mm-hmm. But if necessary, we do have masks and stuff that we can take. And we definitely, after helping unload groceries and stuff, we all wash our hands and just trying to take care of ourselves that way.
And I think there was a question about what the symptoms are of the COVID-19, concern about like what you should be watching for. So the first thing would be fever. Any fever, even if it's mild grade, I would contact your physician and see about whether or not you should get testing. They may recommend, depending on where you are and the availability of testing, to just go ahead and quarantine yourself if you develop a fever. So I would definitely just contact your provider if you develop a fever, even if it's low grade. And then the second thing is a dry cough and sore throat would be the main symptoms. But I have seen patients that are presenting with other symptoms like fever and diarrhea or gastrointestinal symptoms. So it can be varied. But definitely if you feel like your health suddenly takes a turn, you're feeling more fatigued, even if you don't have a fever, I think it would be appropriate for you to just go ahead and contact your provider. They can talk to you about, like what risks have you had, who have been your potential contacts for COVID-19, because they may want not just necessarily to get you tested, it could be possible they want to get other people that you've been in contact tested. So I think just if you have any concerns, just go ahead and contact your provider. I know I'm really trying to communicate with my patients as much as possible, and I would much rather have them reach out to me if they have questions than to stay at home wondering. So, so I think that's the most important thing. Now is the time for allergies. I know in the Chicago area, we're seeing a lot of blooming flowers, and so I'm starting to get like a little bit of a runny nose and like scratchy throat that I tend to get at this time. And a runny nose by itself is not COVID-19. Your typical allergy symptoms are not typical of COVID-19. It's generally going to be a fever, dry cough, and sore throat.
Got it. That's helpful. I know I personally feel like now every ache, pain, sneeze I have, I'm like, oh no, am I getting it? So it's good to refresh ourselves on those symptoms. Do you want to talk at all about medications? We've been hearing in the news different stuff around medications, and I'm just curious what your recommendations are for our kidney patients.
Right. So there's a lot of misinformation on the internet about medications that can be used to prevent COVID-19. Believe me, if there was a way that we could prevent COVID-19 infection in our population, the Centers for Disease Control would be recommending it. I mean, so there is no drug that you can take to prevent COVID-19 infection. The best way is the social distancing and then routine hand washing and what we just talked about. So unfortunately, there's not a drug that can prevent it. Now, there are data that's being collected to determine how to treat COVID-19, but even then, we really don't have a good understanding of the best method for treating COVID-19. So anything you're reading on the internet that makes it sound like there's this magic cure, magic drug for treating COVID-19, it's misinformation. I would, use the Centers for Disease Control as your main source of information for how to treat it, and do not change your medications. Don't start taking any supplements. Don't start taking any medications for prevention of COVID-19. Make sure you talk with your physician before making any changes, but definitely I would avoid supplements, anything that's being touted on the internet. Your kidney, of course, filters the blood, so anything that could be potentially harmful to you. Remember, the highest concentration is going to be in your kidney because it filters all of the drug or supplements out. So you just don't want to cause any harm. So I would recommend making no changes to your medications and do not take any supplements to prevent COVID-19 infection.
That's really helpful. So speaking of following our physicians or our clinicians' advice, I'd love to talk for a few minutes about diet and nutrition. Curtis, I don't know if you have any tips or words of wisdom of how you've been managing your kidney diet during this time.
For me, I've been basically doing pretty good. I know when this first started, was really starting to hear a lot more news and stuff. I did become a little anxious and have a little stress. So I went to my sweets for comfort. But fortunately, I was able to keep a hold on that and then tone that back down. But I actually had a little more issue when I left work and started working from home, where it was easier to get up and run into the kitchen and open the refrigerator or open the pantry, and there were snacks there that normally I wasn't eating during the day. So fortunately, my wife caught me, and she's now providing me with a few more healthier snacks and stuff, even though I may sneak in and steal a cookie or stuff. But other than that, and keeping up with my water intake. And I know at work, I have this wonderful jug that I use as a transplant patient. I have to drink more water and stuff. So I was missing that at home. And so what I did was go out to the internet and order my jug. So I'm back on my water take. And so far things have been going well.
That's great. I love that. I love that you got a new container to watch that or to measure that intake. I think that's a great tool. Dr. Kramer, do you have any other recommendations for people? I mean, the kidney diet is already so hard to manage in the first place. What else would you recommend for people who are dealing with this in the context of this pandemic?
Well, I would say, try to have a plan for what you are planning on eating for the week. Don't just go to the grocery store, you're hungry, and then you start walking around trying to figure out what you should get. Really have a plan of a few meals that you plan to make throughout the week. And then, because you want to limit the time that you're spending in a grocery store. So having a plan is good, and trying to limit the number of times that you go to the grocery store. So I would really just try to, sit down and think about what are some of the things you're going to be eating, over the next week, and purchase those items for those meals. If you can buy fresh produce, I think that's good. But remember that frozen fruits and vegetables, they last longer, and they have, less sodium than the canned versions, and then you can store them in your freezer and then utilize them, over several weeks' time. So I would say, try to think about getting some frozen vegetables and some frozen fruit, and then also think about what are the foods that you should be avoiding. So like how Curtis was saying, shouldn't be eating like the cookies and stuff like that. I know when we went to the grocery store, my daughters wanted to get ice cream, and like the ice cream section was just gone. There wasn't much selection. So obviously we're all feeling really stressed out, and we're using bad foods to try to heal some of that stress, but that actually makes you feel worse. So remembering that eating a healthy diet is actually going to make you feel better. And I also would suggest that if you're not sure about what foods that you should be avoiding, reach out to your provider and ask them to hook you up with a dietitian. Medical nutrition therapy is available to most people who have kidney disease, stage 3 and higher, kidney transplant recipients if they've received a kidney within the past 2 years. Also, should be meeting with a dietitian, and most insurance companies will provide that with no copay. Medicare provides that with no copay. So by all means, reach out to dietitians. You would know, Caitlin, that's what they do for a living. That's what they're trained for. And they're able to give you the best information about diet, much better than even your primary provider or your nephrologist. So
thanks for the shout out. We love getting that recommendation as dietitians. That's great. I think go see a dietitian if you can. And I imagine a lot of them are able to do like phone consultations and telemedicine during this time too. Right. So if you're worried about leaving your house, I don't think you need to. So we've kind of touched a little bit on this already, but sort of the stress that's happening with COVID and how, it's maybe making us eat differently. But Curtis, what else how else are you coping with stress? Like, how are you dealing with it? How are you feeling right now?
I'm feeling pretty good. I know in the beginning, when all of this started, I was having my ups and downs about it. It was reminding me of when 2 instances The first of when I started peritoneal dialysis, and I had to do one of my exchanges at work. So there was the fear of, is the room that I'm going to, is it going to be clean? Am I going to be able to do my exchange with no problems? Am I going to clean up behind myself, make sure my hands are washed, make sure that access point was clean, and be able to continue on with work for the rest of the day? And getting through that portion of it, trying to stay healthy. And then also right after my transplant, when I was getting back into the public and going back to work, and then I was looking around and seeing who was coughing and who was sneezing and how far should I stay away from them and tell them to stay away from me and stuff. So having gone through that, it's made it a little bit easier. And again, I'm getting out, taking walks with my wife and stuff around lunchtime, and then after I'm done with my work day and stuff. So we're still trying to live somewhat of a normal life under these circumstances.
That's great. Dr. Kramer, do you have any other tips that you've been giving your patients or things that you found yourself that are helpful to manage the stress?
Yeah, I would say when the thing first started, I noticed like that I couldn't think straight. Like I constantly forget what I was supposed to be doing, and I had a real hard time, like, focusing on something. I couldn't really read very well, like, just to really focus my mind. And then it wasn't until I finally realized, okay, this is just stress. And the stress is making it so that I'm not functioning like I normally do. And then after I acknowledged that stress and acknowledged the fact that it was affecting me, like, physically, then I think I was able to, like, okay, I need to have a plan to address this. I need to make sure that I exercise. I need to make sure that I, take a walk, go outside, pick up the phone and call a friend. There's also like free apps you can download, and my daughter, showed me this app you can download for free. That's like a 3-minute meditation, just to kind of make you just stop and just relax a few minutes. And that, I think, has really helped with the stress. And I think just also knowing that we're all feeling the same way. Some of us may be more stressed than others, but we're all stressed out. Our lives are completely disrupted, no matter what your age is and where you live. Our lives are disrupted, and it's been happening so fast that we haven't been able to adapt to it. So stress is normal. And I think just acknowledging that and then try to think about ways that you can mitigate that stress, whatever helps you, you should do it. You should try to really help yourself and take a walk or get out the knitting needles or, vacuum your floor, whatever. Just do something to help you deal with that stress. And I know that the National Kidney Foundation has some educational materials on helping patients deal with the stress. And I know you're going to maybe put that out, or we can talk about where they can find that information from the National Kidney Foundation.
Yeah, I think we'll post some links, but we have a whole coronavirus page, kidney.org/coronavirus, and it has all kinds of information on sort of signs and symptoms and sort of the medical information. We've got stuff on nutrition, and then we do have a whole section on coping and sort of managing stress, and some recommended links and just some information. I think we also have other resources that can be really helpful. I know our CARES line is still operating, and so we're just a phone call away. Our trained specialists that can answer questions, they can direct you to individual resources, whether it's help finding food, getting groceries, things like that, or just help coping and stress management, or questions about your kidney disease. All of that, our care staff are definitely here to help. Another great resource that we have that I love is our online communities. So you've talked a little bit about talking with friends and just reaching out to people. And I think that being alone like this or stuck in our houses is really hard when you don't really feel like you have that community. So being able to go to those online communities and chat with other people who are in your shoes as well, who are kidney patients dealing with this, and you're really just a computer screen away. But I think that our online communities are another great resource. Something else that I've found, I know you both have talked about exercise, and I would agree that moving your body is really helpful. And I'm grateful to be in a place as well where I can go outside and exercise, but I know not everyone lives in a city where that's maybe as easy to do right now. So I've found that there's a lot of great YouTube videos on like home yoga, home Pilates, just different ideas like that. So I've found that to be really nice to do when the weather's not so nice or when you can't get out and exercise outside. So that's another resource that I've personally found to be really helpful.
Right, and also just remember, like, if you are stuck in an apartment and you can't go outside, just walking in place. I used to do that when I was pregnant with my second daughter, and my first daughter was just a little baby, and I couldn't leave the house. And you just, you can just walk in place. You don't have to go anywhere, and that's also really helpful.
Yeah, definitely. Well, I think, we've talked about some of these great resources. I don't know, do either of you have any other thoughts or tips or, things that you're doing right now that you think other people might want to learn from?
Curtis?
I would just say, keep living. Don't be scared of the situation. Be concerned about what's going on, but don't be scared to where you're just locking yourself in within yourself. Keep living, keep moving. What we were, have been talking about. Get out. At least open the door, let some fresh air in, and continue to enjoy life. This soon will pass.
Yeah, that's great advice. And I would just also say, really limit how much time you watch the news. Just try to, not look at the internet a lot, put your phone down. And if you feel yourself getting really stressed out, stop, put your phone down, and take a huge breath. And then, if you're feeling really stressed out, don't get back on the news, don't get back on the internet. It's not going to change anything whether or not you know the latest information.
That's really wise advice too. Thanks. Great. Any other thoughts, you guys?
Well, I would just want to emphasize, because you kind of talked a little bit about the food insecurity. I'm really concerned about many of our patients not having access to food or feeling food insecure because the person and their family has lost a job. And just wanted to emphasize that the National Kidney Foundation does have the CARES hotline. They can counsel you on where you can find local food banks and help you. And there's also other kidney disease organizations that also can help you. Don't think that you have to battle this alone. Reach out for help if you feel like you have food insecurity. The National Kidney Foundation wants to make sure that you are getting the food that you need. So please let us know.
Yeah, thank you for that. That's a really good point. Yeah, I think the economic stress that this situation has brought on is equally as scary as the health stress of the disease itself. And I know our care staff have been busy gathering resources in different local communities so that they're ready to help people with food insecurity and with other financial issues. I mean, housing, paying utility bills, all of that. It's all very scary if people are facing, a lack of income. Right. So please call us and reach out to us. We're here to help with that. And we acknowledge that, you're not alone if you're facing those issues. Before we wrap up, Dr. Kramer, do you want to talk at all about some of the other things that NKF is working on for the kidney community, maybe some of our advocacy efforts that we're focused on right now?
Yeah, sure. So one thing that we are really concerned about is making sure that the healthcare providers have patient protective equipment, because we think that's obviously not just a safety issue for the healthcare providers, but also for the patients. We don't want the patients in a dialysis unit to, get COVID-19 from other healthcare workers because they're not adequately protected. So that's something that we've really been advocating for. We're also working with the other organizations like the American Society of Nephrology to make sure that dialysis patients do not have treatments interrupted because they develop COVID-19. We're really concerned that patients will still continue to have a full spectrum of treatment. We don't want patients skipping treatments because of the COVID-19. So those are other issues that we're really concerned about. And of course, we are always concerned about research investment in kidney disease because this is a patient issue. We need more research investment so we can figure out how to get more patients to dialyze at home, which would be the safest place for them, and how to get more patients transplanted, which would be the best option for them. So we're really trying to push for those issues as well, as we always have done.
Yeah, thank you. And Curtis, you're one of our, top advocates. I know you're always helping us with our annual policy day in Washington, D.C. Do you have anything to add about the importance of advocacy for kidney patients?
I would just say continue your advocacy, even from home. Continue to write your congressmen, your senators. We still have bills out there for the Living Donor Protection Act. We still have the Immunosuppressant Act, which will really help a lot of kidney patients in helping with their drugs and paying for that. And just continue to write, like I said, write, contact. You can still call your offices and stuff and continue the fight that's going on out there.
Yeah, thank you. That's great. Well, I just want to say thank you both for being here today. I think it's so nice to talk to both health professionals and patients about what's going on. And I wish we could have done this live and answered some questions, but I'm glad that we were still able to talk and we can share this video with everyone after the fact. And yeah, thanks both of you for being here. And to everyone watching this, please just check out our website, kidney.org/coronavirus, for lots of up-to-date information, and watch for future events like this. We'll hopefully be able to get back on Facebook and answer some questions in real time next time. So thank you both.
Okay.
Thank you.
Well, thank you.